Hello, I'm Dr. James Bogash. I'm the author of the articles on modernhealthness.com. Today I'm going to do a brief primer on why a single-payer system, while in a beautiful, wonderful utopian view, sounds like a great idea. I'm going to explain why here in the United States that is absolutely not going to work and it's the worst thing we could do. For starters, a lot of times people look across the globe and point at different single-payer systems, but we have a different mentality here. First of all, we are a sicker country than all the other ones across, and we are an entitled country. We want our MRI, we want that cardiac procedure, we want our medications, and yet there are a massive amount of services that we do that have absolutely no value to them, or they may actually produce more harm than value. A couple examples right off the top is blood pressure medications for stage 1 hypertension. So blood pressure below 159 or below and 99 and below, there's absolutely no evidence that that actually helps. And the blood pressure medications all have their side effects that will add to the list of problems that are already there. And yet in society, if we come back with the blood pressure of 155 over 96, we want our blood pressure medication. And doctors are not going to stop giving them. The drug companies certainly are not going to give up that source of revenue. Interventional cardiology, so putting in stents for non-emergency chest pain. All it does is help with the chest pain, doesn't make anybody healthier, doesn't lower the rate of open heart surgeries, doesn't lower the rate of heart attacks. This is a billion-dollar industry that is not going to go away. Statin drugs, I've certainly written lots about how worthless this class of drugs is. And so the reality is we do a lot of things that are a waste of money in this society. And unless we can let those go, we will never be able to move to a single payer system. And I think here in the United States, there is too much money involved for us to actually let go of those procedures, because there's a lot of people that would be losing a lot of money in a single payer system that truly follows the research and doesn't waste money on things that are not effective. The other thing that would be required for a single payer system here is responsibility on the part of the insured. We live in the United States. People want to continue to smoke. They want to eat like junk. They want to not exercise, but they want their health insurance. You can't have both. Until we let that go, we can't insure the population without absolutely positively breaking the bank, which we're already starting to see. Obamacare rates continue to go up. People argue about the insurance company raking in the money, but it's not. We're in a wasteful system with people who aren't willing to make the changes that we absolutely know make a difference on long-term health expenditures. Until we're ready as a society to accept that we're going to have to make changes to be insured, then a single payer system will never work. It will be, we can keep arguing about who pays for what. It's the what that we need to get a control of, not a matter of juggling who's going to pay, because as we continue to get sicker, we're just going to be more and more expensive to pay for our health care, if you will.